today's episode, we will see about pink eye and red eye. It's very important to know about this. Pink eye and red eye can be a common, not so harmful condition. At the same time, in some cases, it can be a serious eye-threatening condition. What are the various causes of pink eye and how does it present? If the redness is only one corner, or if it is all over, or if it is in both the eyes, the diagnosis is going to differ. Is it only the redness, or along with redness is one having watering of the eyes, pain in the eyes, difficulty to see bright light, or any hazy vision, and even sometimes colored halos around lights. These are the various ways in which a disease can show up. An isolated redness or redness along with many other eye symptoms. So when you have a red eye, you should also look for what other symptoms you are having. If it is just a redness, a patch on the one side of the eye, and it is not causing any pain and it doesn't have any watering, and more so when you wake up in the morning, the red patch is there and your children or your spouse will tell, but you yourself are not aware unless you look into the mirror. This is a condition called as subconjunctival hemorrhage. It is a small bleed on the outer surface of the eye. Maybe due to rubbing of the eyes, sometimes in those who are having uncontrolled hypertension or those who are on blood thinners. Here, there is no threat to the vision as such, but your general health needs to be looked at. If there is redness in the eye, along with watering and some discharge, the sticky thing that comes in the eye, sometimes when you wake up, the eyelids are sticky, then it could probably a condition called as conjunctivitis. Conjunctivitis is an infection of the outer surface of the eye, wherein some bacteria may be involved or some chemicals may be involved. In this case, you need definitely treatment. If it is a bacterial conjunctivitis, then it is contagious and hence an earlier treatment is required. Some eyes have redness in one corner or redness all across or all around the black of the eye. Small pinkish, more of pinkish rather than redness. Along with that, the person is having difficulty to see light. This redness is little more serious. If redness and difficulty to see light is there, then you should see the doctor at the earliest. It could be a condition called as uveitis, that is an inflammation of the internal part of the eye. There is another kind of a redness where it's only in one corner, and when one closes and opens the eye, a person may have a foreign body sensation as if a sand particle has fallen in the eye, that kind of a feeling. That could be due to a foreign body in the eye, the conjunctival foreign body or a corneal foreign body, or it could be due to a condition called as marginal keratitis. In this situation also, you should see a doctor and you should not ignore. Here, there is redness and foreign body sensation and also little bit of watering or pain associated with the eye, and one should not neglect this. There is one more kind of redness in the eye. There is redness. A person may be having slight blurring of vision, and also when they look at light, around the light, rings of lights, colors may be there. That's called as colored halos. That should not be neglected at all. That is a condition called as acute glaucoma. Here, a person's intraocular pressure has suddenly shot up and it is showing up as redness, watering, blurry vision, and colored halos, along with sometimes they may be having headache. One or any injury to the eye or dryness in the eye can also lead to redness. This is very common these days. Many people are glued to the screens, lot of screen work, desktop work, computer work, laptops, too much of screen time, which is leading to a condition called as dry eye. Here, the lubricating liquid on the surface of the eye is not sufficient enough, or it's not being resurfaced sufficiently enough, leading to a condition called as dry eye. Here again, a patient may have a gritty feeling and some mild kind of a redness might be there. Another common redness that we see, which is not so serious, is when a person goes out driving on a two-wheeler or in a four-wheeler with window shades down, a lot of wind blow happens to the eye. Here, either due to the cold temperature of the air or due to some dust falling into the eye, redness may happen. Here, a person needs to clean the eyes and give rest, and this will subside within few hours. In case this doesn't subside, then it requires an ophthalmologist checkup. In general, redness is one of the symptoms that draws a person's attention, saying that something is wrong in the eyes. This could be a simple problem which may resolve on its own within few hours, or it can be a serious problem. If the redness is not going away within a day or even within few hours, then you should fix up an appointment with your ophthalmologist and see. More so, if redness is associated with pain or blurry vision or difficulty to see light, you should not wait at all. Another kind of redness we see, especially in contact lens users, is when they sleep with the lenses or when they wear the lenses for too long a period of time. Here, it's a warning for them that they should be more careful with the contact lenses and use them according to the requirement. So, you know about the redness in the eye, you know some of the common causes about the redness of the eye. There are many other causes. I just narrated some of the common causes, and you also know when you should not neglect the redness and see your ophthalmologist. Thank you. Take care of your eyes. Stay safe.